The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello to all you TMD warriors out there. I am Tony Urbanek, and this is the latest episode of TMD Demystified. Today, we are going to be talking about treating the patient's emotions along with their TMD. This is by special request from Naomi. After one of our previous episodes that I talked a little bit about the patient's emotions and how to deal with them, and that they do come up. She asked me if I would explain, and expand on that concept with the patients. And at first I thought I covered it. And then on further thought, actually, I didn't cover it. And actually, I didn't emphasize it enough. And I didn't actually tell you everything that I know about this, which is my purpose in doing these episodes. If it isn't obvious, these episodes are me sharing my knowledge about TMD in all aspects, not just the clinical aspect, but basically how to get the product. The purpose is how to treat a patient and get them so that their symptoms of TMD are not there anymore. And that has a lot more to do with just giving them a device, patting them on the head and saying good luck, for sure. And unfortunately, that's if a device is used to treat TMD, that's usually what happens. That's it. And there's so much more. That's why we have a protocol. But we're going to focus today on my experience, my knowledge, and the useful knowledge that I have about understanding and working the patient's emotions so that they can accept and get the treatment they need with the success that I know they can have. Anyone out there who has treated temporomandibular joint patients, and I hope that each and every one of you watching me has at least tried to or had experience treating TMD, and a lot of you are actually our network providers who listen and watch our weekly episodes. Now you have a lot more experience, but believe me, if you are just getting started on treating TMD, you have a lot more to learn. The clinical part is done. The clinical part is explained. The clinical aspects and the steps and the protocol. It is solid. It is in stone. And if you'll just do those things, you can get the clinical result. The issue here today for discussion is, how do you deal with the patient's emotions going through this process? And I can tell you, if you're a medical dental provider, that you're well aware that when you have a patient sitting in the chair, you just don't have a mouth that you're dealing with. That mouth is attached to a body, that body is attached to a person, and all the things that come with it. So, I am not a clinical psychologist. I don't try to be. I don't want to be. What I am is a well-experienced doctor in both medicine and dentistry and surgery and academics, that for 45 plus some years now, I've been dealing with patients under the unusual circumstances that they are going to come and see me for their stated problems, most of them having to do with some kind of pain. And of course, with TMD, it's always pain. As a surgeon, it always wasn't pain, but if they didn't have pain, I was going to inflict some pain on them. That generates all kinds of emotions. And then, of course, the patient comes in with their own emotions that attach to it. That has nothing to do with why they're coming to see you. Excuse me. So actually, in my mind, this is pretty simple. I'm going to try to explain this to you in the simplest terms, because when you yourself think about your own emotions, and I hope each of you do, if you don't have emotions, you got to find some. You know that people go up and down in their emotions. And sometimes people are driven by their analytical skills. And I hope most doctors are mostly driven by their analytical skills, logical skills. I've talked about logic a lot in previous episodes, which are better described as analytical skills. And some people are just driven by their emotions, and they have little to no analytical skills. If you disagree with me, make a comment. I mean, seriously, I encourage comments. I encourage criticisms, but truth is, and then there's people in the middle. You know, everybody's on a bell curve. Everything is on a bell curve. And, you know, at the end of the bell curves are the tails of the bell curves, and then, you know, standard deviations away from the median, or mean, the median. And so, you know, some people are way over here and, you know, absolutely have, you know, no effective emotions, and it's all analytical. And then up the bell curve, down the other side, and over here are the people who are driven only by their emotions. And then the majority of people, the vast majority of people are, you know, one or two standard deviations up here in the middle of the bell curve, and the combination of both analytical and emotional. But today we're going to focus on the emotional part. The analytical part, I'm not going to make a comment on, or how to teach somebody analytics. I think that's a long, hard struggle that starts from childhood. Although emotions, same thing. It's a long, hard struggle that starts from childhood. But on the emotional level, there are literally levels. There are levels of emotions. And they've been explained by many people at many times. There are low emotions going up, 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 up to higher emotions. So I am going to quote from an emotional guidance scale. I'm going to give the person who developed this or stated it the credit for it is. It is valuable only if you know how to use it, like any other scale or any other information. And I'm just going to kind of go over this and get you to understand that as you treat your patients, they're going to come in at some level of this emotional scale. And your job is to get them up to a level of that emotional scale where, number one, they can accept treatment. And then you can drive them with treatment to the point where they're at a very much higher level. I hope that makes sense. It's real obvious to me. And it's obvious because I see it. I see it, and I'm going to explain it. So this particular scale of emotions, from lower emotions to higher emotions, was written in a book called Ask and It Shall Be Given. And the scale, I'm not going to quote it all, but I will, you know, give you some of the, starting with lower emotions, which all of you will understand, going up to higher emotions. So lower emotions start out at things like fear, grief, depression, despair, and powerlessness. Above that is insecurity, guilt, unworthiness. Above that is jealousy. Above that is hatred and rage. Above that is revenge, then anger, discouragement, blame, worry, doubt, disappointment, overwhelmment, frustration, irritation, and impatience, pessimism. We've talked a lot about pessimism as it applies to patients who need and want TMD treatment, which is pessimism is a pretty high tone. I mean, I quoted these from the beginning as to the lower tones. Pessimism is a higher tone. Above pessimism is boredom, then contentment, hopefulness, which is a very important emotion when it comes to treating patients. Then optimism. Above that is positive expectation and belief. And then above that is enthusiasm, eagerness, and happiness. And above that is passion. And then the highest that this scale has developed is joy, appreciation, empowerment, and freedom and love. So you can see that as I went through those, you probably have brought up examples of people with some of those emotions to your mind. Maybe your own emotions, maybe other people's, maybe own emotions and your own emotions. The point is that when you are sitting in a room or standing in a room, hopefully you will be sitting, it's easier to do your consultation and better, with a patient in a chair, one of the things that you need to consider and consider it seriously, because it's going to help you and the patient, is what emotion this patient is exhibiting. That is a good start for you to help them and understand how you are going to address them. Point one, and I am not going to repeat that list of emotions again. There are other lists, maybe better and more expansive, but I think this was a good list. I have no problem with it. But when you're sitting with a patient and in the chair and you are trying to communicate with them, I can promise you that if you have a patient in doubt, you do not want to communicate with them with your emotion on a level of enthusiasm, because you're not going to be real to them. It won't be real. This is a really important, if anything, of this episode. It's a really important point for you to understand and try out. It's like practice it. You know, we all come out of school and we are then allowed to practice. Well, you can practice your skills in dealing with patients, communicating with patients, and you can deal with them on a very high acceptance level when you try to match their emotions as best you can. Now, if somebody comes in boredom, or they come in with hatred, you don't need to go down that far. But I can promise you that, you know, if you pick up one of these lower emotions, you do not want to come at them, discuss with them using your emotional level at a much higher level. You kind of need to go down and match them. So, for example, if they come in and they are worried about their symptoms, and this is a common statement, you know, I hear these noises in my ear, and I'm dizzy all the time, and I'm really worried about that. I had one recently, so use the word worry. It wasn't yesterday, it was last week. I'm really worried about that. Well, again, you don't want to talk about their condition, take their information, do the consultation with your level on enthusiasm. Oh, this is the greatest thing in the whole world. You don't need to be worried about this at all. No, 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 no. You need to acknowledge that you heard that they were worried and say, you know, I can really understand your worry because, and then kind of, because, yeah, when you're hearing these odd noises in your ear, you don't even have to say joint, in your ear, and you're constantly dizzy, I can see that that's really a reason to worry. Well, in the patient's mind, now you're real to them. You've agreed with them. now you're in communication, which is the whole point of why we're talking about emotions. I'm not talking about emotions to make people wrong or make them right, make you wrong or make you right. I am talking about this topic so that you can use this information to better communicate with your patients, get your point across, and bring them up to the point where they have at least optimism, which is a higher level. That's fifth from the top, optimism. If you have an optimistic life, you know a lot of people, some people are very pessimistic. Well, that's down pretty low on this scale of emotions. And there are people that are very optimistic, maybe more optimistic than they should be. And then there are people that the glass is half full and the glass is half empty. But optimism is a very high tone. And when you get your patient sitting in the chair who you now have diagnosed and know that they have the symptoms and they have inflammation in the joints because it hurts when you put your fingers there and push hard from the open to closed position, you know the joint's inflamed, you have your diagnosis, you know what is causing these symptoms. The patient is not sure of it. But now, because of the way you have done your consultation and you've taken your history and you talked about this and as I recommended many times, you go through the symptom list so that you pick out all the other symptoms that the patient has that they didn't know were coming from their temporomandibular joint. And all of a sudden, they understand that they're sitting with someone who actually knows something about this problem that's called TMJ. And that they've talked to 2 other doctors, 5 other doctors, 10 other doctors, plus Dr. Google, plus everybody in their family about this and all their friends. And everyone has given them a different opinion, but nobody seems to know really anything about it. And now they're sitting in front of somebody who has proven to them by your expressions and your knowledge of the symptoms and the relation of their symptoms to the problem itself, that they're sitting in front of somebody that really knows about this problem. And now all of a sudden they go from being maybe overwhelmed, which is in the middle of the scale. I'm overwhelmed by this. I'm worried and overwhelmed by this problem, up to the point of optimism. At that point, when you say, we can take impressions and you can go up front and take up the financial issue with Julie at the front desk and we can get impressions done today. And with that optimism and the level above that, which is positive expectation and belief, they will do that. And then you will be able to help that patient. Obviously, we don't do things that we know aren't going to help patients. Unlike a lot of the dentists out there who actually make a night guard, and give it to the patient and say, this is your treatment for TMD, knowing that it's not going to be the treatment for TMD. We see that a lot. I see it a lot. I stand by that. I'll take all the shots and criticism, arrows, because I said that, but that is true. And I know there are thousands of dentists out there who do exactly that, because I see the night guards and I hear the stories from the patients. So that is not what we do here. We know, and the doctors who are in our network know, that if you use the device and protocol, and the device according to the protocol, and you have a compliant patient, they do the steps themselves, that you will get the result. So when you actually then match that, your knowledge, knowing that you can fix the patient as long as you have a compliant patient, and the fact that now you can bring somebody up from the level of worry or doubt all the way through disappointment, overwhelmment, frustration, pessimism, all the way up to optimism, belief, and expectation. And then above that, going through this list a little further, reading it as I'm sitting here talking to you. Now, the second to the highest emotion that is listed here is passion. When I first read this list, I said, well, how am I going to, address each one of these emotions to a TMD patient? And And the passion one is actually crossed my mind, and it happens more often than you would think. Once you get the patient up to the point where you have resolved their 10-year, 20-year problems, and I say plural intentionally, not problems, not just headache, the headache, earache, shoulder pain, arm pain, ringing in their ears, tinnitus, subjective hearing loss, whatever on the list, their shoulder pain. They get to the point where they're, enthusiastic, but there are some patients above that go passionate about it. I had one yesterday, and she was, whatever her percentage of symptoms were gone, it was high. I think it was, she said 95%. And as she walked out of the room, she said, I have told everybody I know about, and she said, I don't want to hear, I would prefer she would have said about this device and protocol, but she said, you. And I really want to help people. She says, my friends that I've sent here, they all said the same thing. Now, I'm not bragging on myself. I'm just telling you what happened yesterday. This lady was passionate. She had gone from wherever she started, which I have no idea where she started. But when she ended leaving my office yesterday, she was passionate about the resolution of her TMD using this device and protocol. I think hopefully I'm really making my point about this. We can go through this several times because I have so much experience in listening to patients and identifying where they are on this tone scale. Excuse me, my nose is itching. And then with the intention of communicating well with them to bring them up to the level where at least they get optimistic or they have positive expectations, then once they start getting pain relief, they begin being enthusiastic and then more eager actually to follow the protocol, because patient compliance is always a problem, always going to be a problem. But as they actually see the symptoms resolving, then they are more in tune, in line to actually follow the protocol. The first 2 months it isn't tough, but patients that just, they shy away from doing it. I can't go on, do this, can't do this, can't keep it in my mouth 24/7. They're not the majority. I mean, they're the minority. I mean, much less than 10%. I don't know, somewhere probably around 5 or 6%, much less than 10% come in and say, I just, I don't like wearing this. Pretty much no one just enjoys putting that device in their mouth and wearing it 24/7 for 2 months, except when you eat. But when I ask the patient, is it comfortable? Is it too tight or too loose? And is it comfortable? Almost everybody says yes. I never ask them, do they like it really? Because, if you had your druthers, would you put it in your mouth? No. But if you want to get rid of your symptoms, yes. So getting back to your emotional scale, you will have patients that will come in at discouragement. They will come in blaming another doctor. I heard that. Probably heard that twice last week. They're blaming another doctor who misdiagnosed it or gave them something that didn't work. The most recent one I can recall, which was last week, had a crown made. There was nothing wrong with the crown, but she was blaming the crown and the doctor on the fact that it caused the TMD problem. That's a common occurrence in our offices. Common. And I know it's not the crown, and I know that what really happened is a crown was placed. They had to open their mouth widely for a while, and that stimulated the symptoms, the inflammation in the temporomandibular joint. This particular patient, I recall, she was really adamant and juiced up about the fact that it was a one-day crown, and she had to sit there for several hours working this one-day crown, which is much more common technically in our dental atmosphere now. Disappointment. Disappointment is above doubt, but they're disappointed because other treatments haven't worked. They're overwhelmed by their symptoms. They're definitely frustrated. They're definitely impatient. They're frustrated. They want the solution now. You know, that's where the medical doctors, my medical colleagues, they kind of lost view, you know, everything's treated by a pill. And the patients accept that. Now they accept it, and now they expect it. You know, if you have a problem, you better have a pill, which is absurd. It just doesn't work that way. We all know that. Or maybe you think it does, then you need to go back to the drawing boards. Hopelessness, hopefulness, once you get up above pessimism and boredom, then you get into hopefulness and optimism. You get optimistic. I've talked about the patients that I go through my usual litany of symptoms, get them to understand that not only their symptoms that they've identified, but the symptoms that are on the TMD list, going from headache, earache, etc., shoulder pain, arm, hand, finger tingling, and numbness and locking, that I understand it. And those patients will quite often just break into tears because they're hopeful. And the first few people that did that to me years ago, I was still learning, like I'm hoping you're learning. And I said, "Why are you crying?" He says, and the answer was, and multiple answers, multiple times. It's like, you know this problem. I really think that you're going to be able to help me. They're hopeful, but that release of the emotion causes them to cry. They're relieved. These are not uncommon events. In fact, these are common events. They're more often seen than not. So that is why it's important that I address this and that I help you try to understand. This is not just superficial stuff. This is not just some extra stuff to know about treating a TMD patient that it really doesn't make a whole lot of difference. No, it really does make a difference. It makes a difference with you understanding the patient getting the proper communication so that they can come up this tone level, this emotional tone level scale, to the point that they're hopeful, to the point that they are positive expectations, to the point that then they become enthusiastic. And you know, the best way to expand your practice is word of mouth. And like the patient said the other day, I've told all my friends, I sent a bunch of people into you and they all had the same experience. Our pain is gone. Great practice builder. When you know these set of circumstances and you operate with them, you practice it, you will see this. I promise you. I promise you, absolutely, 100%, that if you know this and you follow it and you practice it, you're going to see the results that I'm talking about. So I think that's enough for today. I think it's profound. That's my opinion, and I stick by it. It's profound to be able to utilize this kind of knowledge, which will help your patients and also help you in your practice. If you would like to learn more about how TMJ Services, our company, can teach you to use the Urbanic device and protocol for the betterment of your patients in your practice, you can contact me at Tony at tmjservices.net. Our director of education and marketing at Naomi, who has actually stimulated this episode today. She specifically asked me to do this. Naomi at tmjservices.net. Our website for providers and potential network providers is www.tmjservices.net, which I encourage you to look at. And I encourage anyone watching this episode to go back and review some of the other episodes that I started with. It's been over 6 months ago now. I think this is episode number 46 or 47. I encourage you to look at the other episodes because each and every one of them was my attempt, right or wrong, good or bad, to help you understand not just the problem, TMD, define it for you, discuss it for you, discuss the symptoms, but every aspect of what I've learned about treating TMD over the past 46 years. With that, I look forward to the next time we're able to do our next episode, which I can promise you will be in 1 week. Have a great week, great successful practice.